Hello to our audience today. Welcome to The Way Home, Crossnore Communities for Children's Facebook Live show, as well as our podcast. My name is Holly Kessler, and I am the Senior Director of Community Relations at Crossnore. Every Tuesday afternoon, we're right here on Facebook Live talking with some of our staff members or community partners. We talk about the work that we do, the child welfare system, community partnerships, anything like that, and ways that you can engage with us as well. So if you miss our live show, you can always find it in our Facebook stream and rewatch it, or check us out on our YouTube channel. You can also listen to our podcast that comes out on Fridays on our blog at crossnore.org. So there are lots of ways to watch and engage with us each week. Today, my guest is a new friend, Michelle Hughes. Michelle is a consultant, and she's currently serving with the Center for Trauma Resilient Communities as the project manager for the center's WNC-TRC project. That's a lot of words and a lot of initials, but Michelle is going to tell us all about that today. So please join me in welcoming her to the show. Hello, Michelle.
Hi, Holly. It's nice to be here.
It's good to have you here. I'm so glad to meet you. This is the first time we've done some emailing, but it's the first time we've really seen each other. So
Exactly.
it's great to have you here today. So tell us about who you are, your role at the center, and your consulting role, and anything else that you want to share with us.
Sure. I am a consultant. I work with nonprofit organizations to help them do the best work that they can for the kids and families and communities that they serve. And right now I'm working as a project manager for the Center for Trauma Resilient Communities at Crossnore. And I am helping with a project, as you mentioned, called the Western North Carolina Trauma Resilient Communities Project, which, as you said, is a mouthful. But it is a project in Western North Carolina in 3 different counties, Polk, Henderson, and Transylvania. And I'm really excited to be part of this initiative. Before I became a consultant, I have really spent my entire career working for kids and families, mostly as an advocate. I have done a lot of policy advocacy, working with the General Assembly and with state agencies, and was the executive director of an agency called NC Child, which is the North Carolina's only multi-issue policy organization, advocacy organization for kids. So I am really excited to bring that experience and those sort of skills to this work with Crossnore and the center.
Well, that is awesome. I didn't realize that you had such a long history working in child welfare. So clearly we chose the right person to be our consultant.
Thank you. I'm glad to be here.
Well, we're glad that you're here too. So tell us just briefly, for folks that may be tuning in for the first time, what is the Center for Trauma Resilient Communities? I often describe it as Crossnore's sort of training division, but tell us a little bit more about that.
Yeah, sure. So the center was launched in 2018. It's a division of Crossnore, as you mentioned, and it really is, I think, was launched and developed to support people and organizations to understand trauma, the impact that it has not only on the kids and families that we're serving, but on us as helpers and the organizations that are helping organizations. And then ultimately, not only to understand that, but to begin to build the skills and the knowledge and practices to become trauma informed and trauma resilient, so that we not only are helping our kids and our families heal from trauma, but our organizations themselves are places where staff are working with hope and purpose and are really a renewed sense of well-being, because this work is hard. And not only do we want to make sure the kids are doing well and our families are healing, we want to make sure our staff are also doing well. And the center really is focused on helping organizations become places of healing and hope.
And I think what you said is so important, that not only becoming trauma informed and trauma resilient and teaching that really to the clients that we work with, but also utilizing those tools ourselves as helpers. Even though I'm not in direct care anymore, I hear a lot of stories. I know I see a lot of my colleagues who are in direct care that have what we call vicarious trauma from things that they've heard or witnessed, or the families and children that they're working with. And so it's so important for us, even as support staff, to be a part of this trauma resilient community.
Absolutely.
Well, so we both have mentioned the Western North Carolina TRC project. So tell us about that project specifically and your role as the project manager.
Sure. So Western North Carolina Trauma Resilient Communities Project is a project that is generously funded by the Dogwood Health Trust. It is focused, as I said, on 3 communities in Western North Carolina, so rural communities, Henderson County, Transylvania, and Polk County. And we are working with 12 what we call backbone agencies. So these are agencies that are community-based agencies providing services and supports to kids and families and adults in those rural communities. And the goal of the project is over a period of years to really help those agencies transform their culture and their environment from one that where people may not have all the tools and skills they need to be trauma resilient, but to really work over time and partner with those agencies over time and to build those skills both at the staff level and at the organizational level, and really ultimately at the community level. Because what we know is when we work at multiple levels, individual level, the organizational level, community level, we're much more likely to have a greater impact and a sustainable impact for the folks that we're working with.
Okay. And you mentioned the term backbone agency. So what is a backbone agency?
So Backbone Agency is typically they're nonprofit. We have about 11 at the moment who are participating. We might add a couple more as we move on. But they're community-based agencies that are providing a range of services. So domestic violence shelter, an agency that's providing crisis services to folks who may be homeless, who don't have enough food, or have food insecurity. We have child welfare agency that's involved. And so those are folks that are on the ground providing services to folks who are really struggling and have a lot of adversity and often trauma and stressors in their life. And so those backbone agencies have a core group of folks who are going through training with the center to really learn more about the science of trauma and really the science of how we become resilient. And then that core team will work with their whole agency, with that whole nonprofit, all the staff, to really begin to embed new practices, new skills, and new understanding about how to become trauma resilient over the next few years. And ultimately, what we'd love to see is the connectedness between those different nonprofit agencies and these communities really begin to transform not only the organizational culture, but really the community culture, so that the community becomes a trauma resilient community for the folks who are living there.
That's amazing. So those backbone agencies really are sort of the foundation for where all this work is starting. Absolutely. That you hope then goes up through the entire community.
Yes.
Yeah. That's incredible. And I loved what you said about the practices and the skills, because I think it's so easy to sit in the theory and to talk about the science and, all the theories behind it, but really getting down to actually how do we practice it? That's what makes the difference.
Yeah, right. You have to expect, you can cognitively understand about trauma and what you should be doing, but it's a different thing to actually practice it every day, every meeting with your staff and with your team. That's how you really begin to embody those skills and really live them out as part of your culture and agency.
Yeah, that is amazing. Well, you have a lot of experience, certainly through NC Child, and then your work as a consultant. So let's sort of zoom out a little bit from the Western North Carolina project and think about the need in North Carolina as a whole for this kind of work. Yeah. Talk to us about that and why this is interesting for North Carolina.
Yeah, it's a really great question. I think I mentioned I've been doing this work for a long time, so more than 25 years, really working to try to shape systems and programs and public policy to be pro-kid, to be helpful and supportive of families as they try to raise their children. And so I've been involved in a lot of different initiatives and different projects to try to make North Carolina a better place to be a child and to raise a child. And one of the things that I think is really critical about the time that we're in right now is that, in all the years I've done this work, I've never seen sort of the programs and the systems under such strain as I see them now. And I think, there's a lot of reasons for that. And I think, one thing is we forget what our community has been through over the past, 5 years. We're so forward thinking and we're going to get through it that we forget that our whole country, and really frankly world, has been gone through a lot over the past few years. We've had, just in North Carolina alone and across the US, more than 30,000 people die from the opioid epidemic. That has torn apart families and put huge strain on healthcare systems and law enforcement. We've had tens of thousands of folks in North Carolina die from COVID. We've had kids had their whole lives disrupted from COVID. They've lost parents and grandparents and aunts and uncles. They weren't in school, many of them for 2 years. Zoom learning, it's not seeing their friends. And we've had the country's racial reckoning with the death of George Floyd in 2020. So we've had a lot of stressors, a lot of really traumatic events and time in our country. And that has impacted our kids. So, I think I've been going around saying, like, people are not okay. Kids are not okay. Families are not okay. They're traumatized. And also the helping organizations are made up of people who also have lived through all of those things. Our helpers have lost family members and their kids were not in school for 2 years. So their own lives have been stressed. And then they also are working with kids and families and communities that carry tremendous stressors and challenges and trauma with them, and they are trying to help them. So I think, North Carolina needs the Center for Trauma Resilient Communities, because I really truly believe it is the pathway to really helping our agencies become strong and resilient so that we can, in fact, help kids and families thrive. And I think now more than ever, we are just seeing these systems under such strain that I'm really worried about where they're headed and what that means for our kids and families.
Yeah, I mean, I think I hear people all the time talking about, when we get back to normal. And I think this is it. Like, this is the new normal. There is no going back to, even back to 2020, certainly not to 2018, 2015. Like, this is it. What we have now is our new normal, and we've just got to figure it out.
Yeah, that's right. And I think, like, recognizing the trauma, saying it has impacted me personally. It's impacted my kids for sure. And for those who don't have the resources that my family has, then that is a tremendous challenge for those folks to be able to thrive.
Absolutely. So you've mentioned a lot of the trauma and the stress and strain that our systems are under. And this is a big question, and we probably could talk about it all day long, but kind of in a nutshell, why do you think there is such a crisis in the current behavioral health system, for children and youth? Is it just it all happens so fast, or what's really contributing to that crisis? And is there anything we can do about it?
Yeah, no, it is a really good question. And it's one our state and our country is really struggling with. So, I think there's two big things. The first is what we've been talking about, is that when you think about the developmental trajectory of a child, what they need to be healthy and to grow and to learn and to play, is they need routine. They need stability, and they need some sense of safety and protection and predictability. Well, all that went out the window in COVID for many children. So what we're seeing is what the American Academy of Pediatrics is calling a national crisis of child and youth mental health. We are seeing skyrocketing rates of children with depression, anxiety, suicidal thoughts. We have the highest number of youth suicide in North Carolina than we've ever seen since they've been collecting that data. So there is just a huge need for children to have supports and services to help them recover and to heal from what they've experienced. So that's one part of the issue. I think the second part of the issue is that our systems are not designed to actually provide those services and help in the way that would really be productive and effective.
Right.
So our systems are, pre-COVID, and for a long time, anyone that's been in the, helping fields for mental health or child welfare or juvenile justice knows that those systems are pretty chronically underfunded and chronically understaffed. And they're not designed for prevention and front end.
Right.
Most of them are designed, not all, but most of them are designed to kind of get triggered when kids are in crisis.
In crisis, yeah.
Yeah. So I think now, as we have this explosion of young people, kids and adolescents who are really needing support and help, not necessarily high-end support, although that need that too, but they need support down on the front end, the prevention end of the system. Our systems just aren't financed that way. And in addition, as the staff are really struggling. They've been through several years of challenges and crisis, and the crisis just seems to kind of continue. So folks are kind of burning out and leaving the profession. So we don't have enough mental health clinicians. Child welfare agencies are struggling to even fill positions at the moment.
Yes.
So that pipeline is also broken too. And so all of those factors together are kind of creating this perfect storm where kids are, as you're hearing, sitting in hospital rooms, waiting rooms, and ERs for days because there's no services. They can't find a counselor. They can't find a place for that child. They're sleeping on DSS floors because there's no families to take that child who has that kind of behavioral health issues. So all of that is what's going on right now.
Yeah, and it's a lot. It feels like it just sort of this pressure cooker of things that have come together at one time to make this current situation. And I know certainly through the work of the center, through the work at Crossnore, we've instituted some new family prevention services that you can find out about on our website. But, it's going to take a whole lot more than that, and a lot more people sort of coming around the problem to address it.
Yeah. And just quickly in my former public policy advocate self, things like school social workers, school nurses, really being able to provide more support for pediatricians to be able to do those kind of mental health services in their offices when they're seeing kids. Those things would make a huge difference. Huge
difference. And I wonder too, even about changing some of the standards. For instance, I'm just familiar with a situation where a young adolescent landed in the hospital several times with some suicidal ideation and that kind of thing. And yet the insurance requirements were that she receive intensive in-home services before she could get, inpatient services. Well, when a child is screaming for that much help and has already been in the hospital 3 times, for short-term stays, is in-home really what we need to do, or do we just need to go to inpatient? So there's these rules that are sort of set up that may be not applicable anymore.
Yes.
And maybe we need to change some of those.
Yes, 100%. We need to really think about where the child is, what they need, and how are we going to wrap those services around the child? Because honestly, not only does that save human suffering for the child and the family, it also saves money. Having a child land in the emergency room 3 or 4 times is expensive. And we could be providing a much more effective, much more human, and less costly service and supports for that child the first time they show up.
Absolutely. Well, we've been talking a lot about what happens to children, and I think a lot of us are familiar or are becoming more familiar with adverse childhood experiences. But maybe for those folks who've never heard of ACEs, can you describe we've really sort of been talking about it, but tell folks what ACEs are and kind of why is that important, especially, as you age? Why is that important for adults even to understand adverse childhood experiences?
Yeah, sure. It's a great question. So ACEs is the term we use for adverse childhood experiences. And ACEs are experiences that children have that may be traumatic for them. These are experiences, children, for example, who are growing up with abuse, children who are growing up with a family member who might be incarcerated, a family member who may have untreated mental health issues, violence inside the home. Divorce can be an adverse childhood experience.
Sure.
And so for children, when they have these experiences, if they don't have the support and the relationship and the connection with a trusted adult, those experiences can become overwhelming for the child. And their basically their stress response kicks in. And without a supportive adult who can help them through that experience, their stress response just doesn't turn off. And what happens is that can impact children's brain development. It actually physically change the structure of children's brains and have sort of a lifelong impact, both emotionally, psychologically, and even physically. We know that kids who have experienced a lot of adverse childhood experience, ACEs, are much more likely later on in adulthood to have heart disease, to have high blood pressure, to have a shortened life expectancy. And so ACEs not only sort of impact children sort of in this time of childhood, they play a lifelong sort of role in children's health and development far into adulthood. And that's why they're so important. I think the thing to remember about ACEs is that every human being on the planet experiences adversity. Every child falls off their bike or doesn't make the sports team or fails a test or loses a grandparent, right? We all have experienced adversity. So it's a normal part of human experience and development. What's different about ACEs is that they are so overwhelming for a child, particularly if that child doesn't have adult support, that it can really just shut them down. It floods their systems, and it makes them feel powerless. It makes them feel helpless, and it really, again, has that lifelong impact. So that's, I think, an important difference.
Yeah, and I think I ask you that question just because I think it goes to why, as adults, should we be concerned about this, not only for the children in our systems, but even for our communities. You mentioned that, there can be protective factors that help children as they grow to sort of mitigate the effect of some of those ACEs. But I think the same thing is true for adults. Sort of when you recognize the trauma that you've had, then you can look at the other resources in your life and what is helping you cope and mitigate those that traumatic experiences in a healthy manner.
Yes.
So all of that really just sort of plays into the whole thing that you've been talking about our systems in North Carolina, about how we can work at the organizational level, at the community level, and make some real important changes, both for individuals and for our entire communities.
No, exactly. I think that is absolutely right. And I kind of always think of it like a sort of a scale, right? So you've got risk factors, you've got adversities that kind of can really potentially harm. But if you have on the other side of the scale protective factors, loving adults, relationships, connections, a teacher at a school who cares for you, a neighbor who feels like loves you and protects you, those kinds of protective factors make a huge difference for a child's life and really can mitigate the harm of adversity.
Well, Michelle, we could talk all day long, and I'm going to need to have you come back and let's dig into some of this stuff in more detail. But for now, tell our folks how they can find out more about the work that the center is doing.
Absolutely. Folks can go to the website. It's www.traumaresilient.org. And again, it is part of the Crossnore website. And so feel free to go and learn more information.
That is great. Thank you so much for being here with us, Michelle. I'll look forward to having you back again.
Absolutely. Thanks for having me, Holly.
Sure thing. Well, friends, as I have thanked our guests for today, let me also say thanks to each of you who are watching or listening. We appreciate the opportunity to tell you about Crossnore and about the Center for Trauma Resilient Communities, about the work that we're doing in North Carolina and in other parts of the country. So for more information, please visit our website at crossnore.org or follow us on our social media channels on Facebook, Instagram, or LinkedIn. That's it for today, but I hope you will join us again next week on the way home.